Good morning, everyone, and thanks, Natalie, for the invitation to come and speak. It's great to be back, albeit for a short time. So I did this presentation at the Aeromedical Conference last year in September, and it's amazing how quickly the area has moved on since then. But I too would like to acknowledge the traditional owners of the land and air in which we fly and work. And I also ask for the foregrounding of Indigenous wisdom and First Nations wisdom in responding to climate change. So just a quick disclaimer, any opinions are my own. I have permission from the College of Nursing to present this, but it does not present the College of Nursing's position, and all images I've sourced on Google for scholarly purposes. So I want to just tell you a little bit about Vicki. So Vicki lives on Wangan and Jagalingou land up in central Queensland. She's a 65-year-old grandmother who has, in her 40s, had early stage breast cancer, had a mastectomy and axillary clearance, and suffers severe lymphedema in the left arm, which is heat sensitive. She also developed post-radiotherapy diverticulitis and has frequent bouts that causes her severe dehydration, and she's also has some arthritis that is heat sensitive. Why am I telling you about Vicki? Well, Vicki is very sensitive to the effects of climate change. In summer out there, it's routinely over 40, 45 degrees every day. And the summer that Vicki just had is going to be her coldest summer for the rest of her life. So why am I talking about Vicki? Because Vicki's actually my mum, and I'm really concerned about her going forward as the effects of climate change take effect on our health. I don't want to see pictures like this, and anyone who worked in New South Wales aeromedical retrieval in 2009 will remember the bushfires and the impact that they had on us and our services. Our services are going to be needed more and more and more as the climate gets hotter and hotter and hotter. And why do we call it a code red for aeromedical? Well, the IPCC, the working group in 2021, declared climate change as a code red for humanity. We are at the tipping point. We need to do something about this now. But what is climate change? Well, climate change really is the natural effect of the oscillating temperatures of the Earth. What is most significant and is related to human climate change is that in the last 150 years since industrialisation is that the Earth has got hotter and hotter and hotter. We're now 1 degree hotter than we were in 100 years ago. This shows the climate change and natural temperature change in New South Wales since 1858. And you can see there in that last decade, from around about the 2000s, we have just got hotter and hotter and hotter. And we are expecting that to continue unless we start to reduce emissions very quickly. So this is looking at CO2, and CO2 is the biggest greenhouse gas that is causing this effect. So the release of CO2 into the atmosphere causes the build-up over the globe and creates a nice little incubator, humidicrib, or greenhouse for us here. And as you can see, since in the late industrial era, it has just gone up significantly. We're also having a look at the industries that are most important, and unsurprisingly, the largest cause of greenhouse gases is emissions from fossil fuel and industry, over a third from burning of coal and oil. But how is climate change a health issue? Why am I here talking about climate as a health issue? Well, climate has a paradox effect on health. Health causes a large amount of greenhouse gases, but it also has a huge impact directly and indirectly on the patient cohort that you're looking after. So heat waves, as we've just spoken about, and that's my biggest concern for my mum living out there in central Queensland. Storms, we've looked at the frequency of storms, and they are getting more and more. So that has huge impacts on, look at Lismore last year, the double flood that they had. I'm sure you're all responding and saw the devastating effects of that. Drought, we're probably just about to go into our 10 years drought. Air quality, if you look at northern Thailand at the moment with over 1,000 admissions per day with respiratory issues related to the air quality. We're looking at water, ecosystem change, and all the long-term effects of the cardiorespiratory disease, cancers, allergies, and mental illness is probably the emerging area in here. We have huge amounts of post-event trauma related to the floods and fires of 2019 and 2021. So the World Health Organization are suggesting from next year there's going to be around about 250,000 deaths per annum specifically related to climate change. And if you look at the Bangladesh floods of the last monsoon season and the death toll there, 250,000 is actually probably a conservative estimate. So as I said, there is this paradox of climate change. Healthcare contributes up to about 7% of all admissions in Australia. So that's more than all the admissions put together for South Australia. And if we look at the health system in Australia, that's more than the 13th largest country. So health is extremely high carbon, high emitting industry, but healthcare also must care for those most affected by climate. And we've seen some photos here of the Lismore floods on the left, the 2019 bushfires, and of course that's Cyclone Yasi, where they evacuated the entire hospital in Cairns in far north Queensland, including the neonatal unit. So we find ourselves in an extremely interesting space where we need to reduce emissions and also adapt for the worsening Anthropocene. And aeromedical services at the forefront of natural disasters. And I think there's some defence colleagues here as well. And the defence are also impacted heavily by natural disasters. So those that are most vulnerable to climate change include any of those where the social determinants of health affect. So looking at children, rural communities, pregnant women, remote Aboriginal and First Nation people, older people, tourists. So if we think about all of those, they are aeromedical's primary consumers. That's the biggest space that aeromedical and retrieval services fit into, is looking after all of those people. So we really, as an aeromedical community, need to sit up and take notice. So I like to have this quote from Jane Goodall because what it says to me is that apathy is our greatest danger to this going forward. We need to do something about it. We're like the frog in that boiling water. We need to actually do something and reduce emissions and adapt our practice for the Anthropocene. So I had a quick look and had a look at what is health doing across Australia. And Australia is quite far behind Europe. Europe is the leading in this. There's the Climate and Health Alliance, and they're part of the Global Green and Healthy Hospitals. And they are a worldwide organisation that is trying to green hospitals and healthcare. And they talk about leadership. Leadership is one of the most important, and sustainability, like we have a safety management system, looking at a climate risk system where sustainability, regeneration and adaptation to climate change becomes part of everything we do. There's a lot of chemical management. There's fluorine, for the anaesthetists in the room, is a really toxic greenhouse gas, and you'll see that the use of desflurane has been reduced across the world. England and Scotland are now desflurane-free and using alternative anaesthetic gases. Waste management is really important, as you can well imagine. We know how much waste, if we think about the COVID-19 pandemic, think about how much PPE and plastic and oil and resources that we have generated as part of that. Electricity, obviously important. As I said, a third of all greenhouse gases come from electricity, so moving to sustainable and green energy. Easier said than done. Australia's missed the boat. We need to provide our power source to our growing population whilst being sustainable. Water management, that's going to come critical over the next probably 10 years as Australia re-enters into its drought phase. Transport, looking at transport, and that's where aeromedical services really come in. Food and food wastage is massive in hospitals, and Hunter New England are trialling where patients order food on demand and moving to plant-based food, which is a really interesting space. Medications, pharmaceuticals is another huge area of concern and production of emissions that related to healthcare. Buildings and infrastructure, absolutely. And of course, recycling and waste reduction. Just before I left New South Wales Health, I was involved in establishing the Climate Risk and Net Zero Unit. So that started in 2022, and New South Wales Health have really taken a hard stand and have started a unit. And if you actually go onto that website internally on your intranet, there's a lot of information, and they're doing a lot of work towards net zero by 2030, looking at zero waste and reducing. Hunter New England up in Armidale in that area has 100% green energy and runs on 100% green energy now. So there has been a lot of work done in the New South Wales context to reduce healthcare admissions. So this was our call to the Australian healthcare or to the Health Minister or to the Australian Government last year in the political platform we took. So we were asking for a national inquiry into healthcare admissions. We need to know what our emissions are before we can start to reduce them. We wanted a national health resilience and emission reduction framework and a national body to administer. And as you're probably aware, only very recently in March this year, the Federal Health Minister has launched the Australia's first National Health and Climate Strategy and now a National Health and Sustainability and Climate Unit. So they've actually launched this and are at a roundtable establishing what that looks like. So it's a really, really important time, and it'd be a great time for Aeromedical to have a seat at that table. Work that I'm doing in the planetary health space and sustainability space with climate action nurses, we're heavily involved in making sure the nursing voice is heard at this particular table. So we'll have a look at what aviation is doing, and there is a lot going on in this space with aviation. Particularly in Europe, we have the Clean Aviation Association in Europe, and Eurocontrol has a whole sustainability unit, and they're moving very, very quickly to look at alternative propulsion methods and putting millions of euros into coming up with different propulsion methods, mainly focusing on hydrogen and sustainable aviation fuel. And also looking at airframe design. Strut wing seems to be the way in fixed-wing aircraft as a way to reduce drag and reduce fuel. You can see there that Leonardo, the AW149, had their first flight with fully sustainable fuel. So the rotary ring space is definitely there. And you'll see that the Australian government is managing the carbon footprint of Australian aviation. That was put together in 2017. There's currently a roundtable at the moment looking at what Australia is going to do in the aviation sustainability space. What are we doing in Australia? So as we said, Airbus is testing hydrogen power. Their very first A380 is rigged up and looking at hydrogen. That technology is a little way off. We've got local airlines like Rex looking at moving on to electric propulsion on their Saab 340, and they've just signed a big deal with a local company to develop that technology. We're looking at Qantas. So Qantas has a Chief Sustainability Officer appointed to the board in 2021, and we now have a complete climate risk management strategy and looking at reducing the carbon footprint. Commercial aviation is catching up because they've decided very quickly that without sustainability, there's going to be no business, and without business, there's no money for shareholders. So there's a lot of money going into this area at the moment. Sustainable aviation fuel seems to be the biggest way. I have my own thoughts on sustainable aviation fuel, but it's definitely a stopgap as they transition to further things. Skytrains in Queensland have committed to developing the first hydrogen-powered aircraft, and there's huge amounts of work going on in that space. So what are doctors and our medical colleagues doing? So there's the Doctors for Environment Australia, and if you haven't heard of them, they are a very influential and active group, and they have their Doctors for Environment conference in 2023. Worth looking at them. They have some great policy and great ways that medicos and doctors can contribute to this, because we need to get over the turf wars of practice here. This is everyone's problem, and we need really interdisciplinary and inter-industry consultation to change this space. So what are nurses and midwives doing? I can talk about that, having been a nurse and midwife and working with the College of Nursing in the emissions reductions policy chapter space. Been heavily involved in engaging Parliament over this, and also a co-founding member of Climate Action Nurses. So we've written a raft of guiding principles and position statements that went to COP26 with then Prime Minister Scott Morrison, and really looking at getting this nursing voice into climate change. We're about to bring the Nurses Climate Challenge to Australia, very popular and very successful in Europe and America, which is about health professionals educating other health professionals. Exactly what we're doing here today is the start, because certainly when I joined the Australian College of Nursing in this space, I didn't understand how emissions reduction was related to healthcare. And as I said, co-founder of Climate Action Nurses, and we have a backbone organisation funding us now, and we're getting on our way. If anyone wants to join us, and it's open to everyone, feel free to click on the link there, the QR code, and more than happy to get on there as we're grassroots growing as much as possible. And we would love to have you, because we need all hands on deck. So what do we think is the way to go forward? So Nurses Champion Climate Change, that's what I'm doing here today, helping to educate and say that climate change is a health issue. It innocuously is going to affect all our contexts of practice going forward. We want to lead sustainable practices in healthcare, and there are so many little things that everyone can do. We've done a great project over at Fiona Stanley in Western Australia with the reduction of bluey usage, and reduced bluey usage by over 90%, which was an absolute amount of blueies that were going into the rubbish. There's some great work that's been done in renal dialysis through Victoria in reducing landfill, and but roughly 1 tonne a day of waste is not going into landfill and being reused, including sending all the consumables to veterinary hospitals and other places that can be reused. And in, once again, Hunter New England in New South Wales have come up with this revolutionary idea of autoclaving plastic and reusable things in theatre. So it's a little bit back to the future for me, having started 23 years ago in nursing. I remember those disposable sets, and we're coming back to, those autoclavable and reusable theatre sets. So we're coming back to that. It's really about interdisciplinary global collaboration. This is a human problem across the globe, and something that requires us to look within and without industry. We really need doctors, nurses and paramedic voices in other industries, because I really believe that doctors, nurses, healthcare professionals have the most common sense approaches and practical solutions for everyone. So we really need to foreground that healthcare wisdom, and of course contributing to the informed policy and research. And there's a growing amount of research that's being generated in this space. In fact, it's rapidly evolving. We just released the nursing response to the climate emergency with the Australian College of Nursing in March this year, and we'll be looking to bring that to a parliamentary breakfast very, very soon. And it has some practical solutions that you can get off the ACN website if you're interested in that. So then I guess come to the question that I really want to pose you today and take away today is, what is Australian and New Zealand aeromedical doing in relation to climate change? I know in the New South Wales Ambulance Strategic Direction that was released last year or the year before, sustainability and climate change was one of the key drivers. Victorian Ambulance is far advanced on this with green vehicles, electric vehicles, different changes to their buildings. They're one of the world leaders in the ambulance space with sustainability. And the Australian and New Zealand aeromedical space is just starting to catch up on this. So I pose to you, what is the aeromedical carbon footprint? Because we need to know what the carbon footprint is before we reduce it. So I did some very quick research, and it's very, very difficult to find the rotary data. So I apologise that this is fixed-wing aircraft very heavy. The rotary companies seem to be holding on to that data, despite Leonardo doing a lot of sustainability work. They're not willing to publish their carbon emissions. So that's a raft of the aeromedical fixed-wing aircraft that fly in Australia. And you can see, particularly in the New South Wales context, you operate King Air 350s. So they're around about 2,870 pounds per metre per hour. So not too bad, but it's still, still a lot of carbon emissions that we're having a year, bearing in mind that when I left New South Wales Ambulance, fixed wing, we're doing around about 6,000 missions a year. So that's a lot of hours of flying. And it'll be interesting, I couldn't find the data on the PC-24, but the PC-12s are significantly less heavy carbon emitters, but of course they're single engine operations. So what's the way forward that I propose to you? It'd be great to develop a national aeromedical sustainability group and framework through the Aeromedical Society of Australasia and Flight Nurses Australia. So I challenge people in the industry to take that forward and start looking at what everyone is doing. Knowing what the industry admissions are, that's really, really important. And it would be a really great research project for someone to have a look at that, because we are looking at aircraft emissions along with all the consumables and the healthcare emissions that we make. We want to have reduction targets that are measurable and accountable and reportable. Looking at aircraft procurement going forward, making sure that we're looking at the most sustainable options. And also retrofitting and championing our aerospace engineers if electric power plants or hydrogen and those technologies start to come to the forefront, we can definitely start looking at getting those retrofitted to our aircraft. Investment in sustainable aviation fuel or hydrogen or hybrid aircraft, that's definitely a start. Aeromedical buildings, looking at making sure that they're sustainable, collecting water. You've got great spaces. There's not a lot of trees around airports, so you've got a great way to make solar energy. Developing an aeromedical sustainability policy and looking at everything that's that you can do. Aircraft tasking is a very interesting one, and that has a huge amount to reduce your carbon footprint by doing pragmatic tasking of aircraft. Having a sustainability nurse to lead that interprofessional collaboration, and not so much to the Bankstown or Sydney HEMS in environment, because it's a paramedic doctor workforce, but across the rest of the industry, nurses are the largest workforce in aeromedical, so activating that nursing workforce is really important. And you've also got your nursing workforce over at the fixed wing base, and there's a large group of passionate nurses over there. So Jane Goodall again, and this is a picture of Los Angeles on the left and on the right, and this was during the COVID lockdown. So just reducing the amount of cars on and burning of the petrol and things like that with just general transport, it actually saw a marked increase in air quality purely related to emissions. So being a human factors practitioner, and I can't leave you without some primatology. So Jane Goodall really looks here as gorillas and orangutans have lived in harmony with nature and haven't actually destroyed it. Us as primates have maybe not lived as much as harmony. And there's a really interesting new movement coming out called eco-modernism, which is suggesting that humans decouple from nature rather than go back to ecology. So really interesting thoughts as we go forward, and there's definitely some emerging thoughts going around it. So I'll leave you with David Attenborough. If working apart we are force powerful enough to destabilise our planet, surely working together we are powerful enough to save it. In his lifetime, he's witnessed a terrible decline. In ours, we could and should witness a wonderful recovery. And I really leave with hope, because I want to do it for these people as we go forward. So thank you very much.